Hello everyone. Today we will be learning about the gastropathy and gastritis. So the common features of gastropathy and gastritis, their morphology is mucosa may be hyperemic or swollen, and the hemorrhage visible as dark punctuate areas. Mucosa may be hyperemic swollen, hemorrhage visible as dark punctuate areas, and erosions plus hemorrhage. They give rise to acute erosive hemorrhagic gastritis. Acute gastritis, when the mucosal injury plus the neutrophils are present, the lesion is referred to as acute gastritis. And gastropathy, when cell injury and regeneration present but the inflammatory cells are absent, that is known as gastropathy. So acute gastritis में क्या होता है? There is mucosal injury plus inflammatory cells means neutrophils, and in gastropathy, cell injury or mucosal injury plus regeneration, but inflammatory cells are absent. Pathogenesis is non-steroidal anti-inflammatory drugs, NSAIDs, H. pylori, Helicobacter pylori, reduced mucin and bicarbonate secretion, hypoxemia. Here in the pathogenesis, we can see that normally we have these layers, mucus, mucosa. Firstly, mucus is present, mucosa is the layer, muscularis mucosa and submucosa. Now, normally the damaging factors are gastric acidity and peptic enzyme. Now, the defensive forces which defends that, these are mucus secretion, bicarbonate, mucosal blood flow, apical surface, membrane transport, and prostaglandin synthesis. Now, here, because injury, the factors which are leading to the injury, these are those factors like Helicobacter pylori, NSAIDs, aspirin, tobacco, alcohol, gastric reflux. So that mucus is become very less, so that area got injured. Now injuries का exposure हो जाएगा यहाँ पे. Impaired defense. So here we can say we are having impaired defense. Now because of these impaired defenses, now ulcer is formed. So here will be the formation of neurotic debris, inflammatory cells, granulation tissue, and fibrosis. You can remember this by NICS. So N means neurotic debris, I inflammatory cells, granulation tissue, and fibrosis. Ulcers में ये सब चीज़ें होती हैं. Now chronic gastritis, most common cause is Helicobacter pylori. Autoimmune gastritis associated with gastric atrophy. Most common cause of chronic gastritis without H. pylori infection. Chronic NSAID use is third important cause of chronic gastritis.